event underscores our strategic and unwavering commitment to improving availability, access, and quality of healthcare services and other life-saving interventions to the residents of Turkana. We are dispatching today to present more than just medical conditions. They symbolize our administration's resolve to protect life, strengthen our healthcare system, and bring healthcare services closer to the people. This initiative aligns with our health sector reforms and acceleration of efforts towards universal healthcare coverage. By distributing these health products and technologies across our health facilities, we aim to increase life expectancy, reduce the disease burden, and promote overall well-being of our people. And so we are laying a foundation for a healthier future. Let me commend our healthcare workers who remain at the forefront of service delivery in this county. These medical supplies are provided to empower you to ease your workload and to ensure you continue to deliver quality and dignifying healthcare services. This represents the county's investments in ensuring that our people have continued access to life-saving pharmaceutical drugs, medical supplies, and other essential commodities for the half period of 2025-2026 financial year. I want to reiterate that this is, if not the third, the second consignment that we have delivered within a record time of 2 to 3 months. And we continue to prioritize investments in healthcare to ensure that we have constant supplies that meets the demands of our people. We are generating the list for medical supplies from health facilities, and those health facilities, their requests are put together. They form the final consignment from KEMSA. And KEMSA packages these things to be delivered directly to the health facility. Turkana County Government is among the 3 counties that continue to support the work of KEMSA. We are recognized as one of the counties that have paid their debt. We are up to date with our debt with KEMSA, and there is a recognition and award towards that effort. The consignment of 120 million is based on our ability to be able to make sure that this money is available and paid to KEMSA, and that our credit worthiness for medical supplies and commodities continue to be something that is going to be supported. It is my hope that this initiative will contribute significantly to reducing preventable deaths, improving public health outcomes, and ultimately restore the confidence of the Turkana residents in our healthcare system.
In the month of July, for those of you who will recall, I gave a commitment of this department through the County Executive Committee member for Health, Dr. Joseph FM, that we will ensure uninterrupted availability of health products in all our health facilities. Because this is the commitment that the Governor of Turkana, His Excellency Jeremiah Khamais Napotka Lumorkai, and His Excellency Dr. John Erus gave to the people of Turkana. The supplies received in the last order were projected to take us until September. And through a proactive approach adopted by the Ministry of Health Services and Sanitation and the Directorate of Health Products and Technologies, we have quantified and forecasted that in the next 6 to 8 months, we shall need 120 million worth of health products and technologies. And that, ladies and gentlemen, is what you see in front of you. When we talk of medical supplies, it is never just about drugs. We have pharmaceutical supplies, which you guys call drugs. We have non-pharmaceutical supplies, which include syringes, jig, X-ray films. We have things to do with vaccines. We have to do things like laboratory reagents. And all those, they constitute and equipments, they constitute what we call medical supplies. This represents the county's investment in ensuring that our people have continued access to life-saving pharmaceutical drugs, medical products, and other essential commodities for this financial year. The order on this consignment is based on the actual needs generated from 234 health facilities. They were packaged in Kemsa, Nairobi, purposely for specific health facilities, and they are not supposed to stop anywhere except and until they reach those health facilities, including they had to reach areas of Longech that have been affected by Lake Turkana overflow, under the principle of what we call the last mile principle. We are proud partners, and we acknowledge the recognition of the county by the Kenya Medical Supply Agency. In the whole country, Turkana County was recognized in terms of commodity management as the best county for that, and we received a trophy and also recognition of our county pharmacist, Dr. Brian Moyokani, as the best county pharmacist in terms of leading his county in commodity management. What this demonstrates, in my view, is our prudence as a county government in the management of these commodities, enhancing accountability, and in as far as I'm concerned, reducing wastage. Together with other stakeholders, we can bridge any gaps that may exist in the health supply chain. Our ultimate goal is to make sure our health system is strengthened so that no member of our community is unable to access healthcare services due to lack of HPT, both for diagnosis and treatment of their pathologies in public health facilities in Turkana. These commodities, they are not supposed to go only to public health facilities. They are also going to faith-based organizations, including Catholic facilities, PAG facilities, AIC facilities, RCA facilities. And in terms of level 2, which are dispensaries, and level 3, these drugs are supposed to be for free. And in level 4, which are sub-county hospitals, they are supposed to be offered at highly subsidized rate. The healthcare workers of Turkana County are the backbone of our health system. Day in and day out, they continue to serve our hospitals, health centers, and dispensaries with unrivaled professionalism and dedication. The commitment has ensured that the people of Turkana County access highest attainable health standards as envisaged in Article 43A of the Constitution of Kenya. I encourage them, wherever they are, to continue upholding ethical and professional standards in this noble service to the people of Turkana. But, however, let me also point out this. The security and rational utilization of these commodities is a delegated responsibility by the governor and the deputy governor and the people of Turkana to our hands, to ensure that all of our health facilities have all essential health products to be able to cater for the needs of the populace. We must therefore not permit pilferage, theft, irrational use, or wastage of any kind. We will continue monitoring and following up and tracking these commodities to ensure that they have been used and used very well, up until every tablet, every vial, and every medical supply has been accounted for. Let us work hand in hand to ensure that these products are used responsibly and that they reach those who need them most, and ultimately help us achieve healthier and stronger Turkana County.